Hello, I'm Josh. I'm the Marketing Manager at Fire Chief Global, and I'm excited to be here today with Sue, who is an ambassador for the Children's Burns Trust and also a senior nurse practitioner at a burns centre. Hello, Sue.
Hello.
Glad to have you along for this. Thanks for coming.
It's nice to meet you.
So let's just start off with what does an average day look like for you in your role at a burns centre?
So as you say, I work as a burns advanced nurse practitioner, which means I'm a clinical senior nurse for most of my role. So looking after children and adults with burn injuries through their journey. And I say journey because it really is a journey for the patients. I work as part of a team, a multidisciplinary team, so there's lots of people involved in helping patients to get better from a burn injury, including the doctors, the nurses, the physiotherapists, occupational therapists, you've got psychotherapists, dietitians. It's huge, it's a huge team. And I've been doing that for about 25 years now, which I very much enjoy.
Very interesting. So talking about burns then, obviously you've seen a lot and you understand a lot about how burns work and how best to deal with a burn. What is the best immediate action someone can take if them or a family member has a burn?
It's a really important question actually, because it's so important that people get that bit right. It makes so much difference to how their journey goes after that. So we have quite a short saying, which is cool, call and cover, which basically means cool the burn, so 20 minutes of cool running water, which is a really long time in a screaming, wriggly child. Any cooling is better than no cooling, but if you can manage to do it for around 20 minutes, we know that you get the best outcomes because it cools down the burn and stops it burning through the layers of the skin. The next stage would be to call, and that's to call for some help, whether that be to call somebody, your neighbour, to come and help you, whether it's to call an ambulance, the 111 service for advice, your GP, or maybe go to your pharmacy, depends how big the burn is, but certainly get some help. And the third one is cover, which is cover the burn lightly in something like cling film, and that helps to protect the skin from infection. It makes it a bit more comfortable. But also people after burn injuries, particularly if you've done that cooling, can get quite cold, and then people can go into shock. So by covering them in cling film and then you can wrap them in a blanket, then you get your best outcomes. And we can really tell the patients that have done good first aid as to how deep their burn is when they get to us.
It's interesting. So that immediate step has a big impact.
It really does.
That's good to understand. What, in your work, what is the most common fire-related burn injury that you see both across children and adults? It may differ between the two, maybe.
Yeah, so fire-related burns, if it's an adult, then the most common burn is putting petrol or an accelerant onto a bonfire.
Really?
We all know we shouldn't do it. But everybody gets really tempted, particularly if you just want to crack on, or a barbecue, trying to get it going, you're hungry, you want to crack on. And so we do see that a lot in adult patients, and unfortunately you get like a flash flame, which flashes back, it can catch clothes on fire and you can get really nasty injuries from it. That's the main one that we see in adults. In children, we don't see so many flame injuries. It tends to be more scalding injuries. But if we do see flame, unfortunately, it's often from things like house fires or ignition of clothing from candles, for instance, that are in a house. We see things like children like to dress up, they like to wear fancy dress. Unfortunately, fancy dress clothing doesn't meet the National British Standards for safety, and so it's often very flammable. So they're at a party, they're wearing a nice pretty party dress that's a Disney princess dress, and there's candles on the cake, and they get ignitions of their clothing, unfortunately. So we do see that kind of injury as well quite a lot. The other thing we see is hot oil pans. So people are cooking with hot oil, it ignites, they panic, they grab the pan, they try and make a dash for the door, and the flames flash back. And ignite their clothing, ignite the room around them, and so we see the flame burns from those as well.
Yeah, that's a real big risk. It's very, very dangerous, and a lot of people don't necessarily realise that you shouldn't put water on oil fires as well.
And then again you get your big flashback of the flames. It ignites things in the room, it ignites the clothing, and you can get really serious injuries.
That's interesting, very interesting. We just talked about oil pans, so we've actually just talked about the kitchen, which might be where this question goes, but are there any particular areas of the home where fire-related burns, or burns generally, most often occur?
So as you say, in the kitchen, cooking, particularly if somebody's using a gas cooker, clothes can ignite. The garden is another area again with the barbecues and fires from those. So most of the fire-related ones tend to happen in the kitchen, although we are seeing an increasing number of injuries from house fires where people are, say for instance, charging their mobile phone in their bedroom with a charger that maybe isn't compatible by the cheaper cables offline. And people are using those. People tend to charge overnight because it's more convenient when they're not using their phone. And they can start smoking, and then they can ignite, and it can ignite your bed clothing. So we're seeing an increasing number of house fires from those kind of things. Alongside that, a huge increase in people using e-scooters and e-bikes, and the lithium batteries that come with those. The trouble with those is that you tend to charge overnight again. You tend to charge them in a corridor or in the hallway, and they don't often smoke before they ignite, so you don't necessarily get that warning for your smoke alarms to go off. And then they explode, and you get this toxic fumes that fill the air, and often your fire exit is blocked. So we're seeing some really nasty injuries where families are trapped inside their homes from fires from those. And people often buy a cheaper battery because it's a bit cheaper than the very expensive ones. And if it's something like a scooter, the battery is positioned usually underneath the base of the scooter, and you're kind of crashing it up and down the curbs, and it gets a little bit knocked, it gets a bit damaged, and you don't realise. People also adapt. They adapt a normal bike into an electric bike by strapping a battery around it, and again, those batteries are not compatible, and then they can explode overnight.
It's very good to be aware of that, because that is a major risk.
It is. Delivery drivers particularly, we get a lot of delivery drivers now. Everybody wants their takeaway delivered at home, and so lots of delivery drivers can't afford to run a car. It's cheaper to have a scooter, e-scooter or an e-bike to zip around the town, and so that's really increased the risks.
Interesting, very interesting. So you talked about earlier the different options in terms of cool and then cool, or the second cool, so cooling out for some kind of help. How quickly can a minor burn escalate into a major or more serious problem if it's not dealt with and treated properly?
Very quickly, actually. The first aid really makes a difference, and we know unfortunately that some people don't realise that the best thing is cool running water for a burn injury, and so they might ask a friend or a relative who comes up with a different idea about how to look after the burn, and actually that can make the burn worse. So for instance, people don't realise that if you apply ice to a burn, people think, oh cool, I'll put some ice on. If you apply ice to a burn, what it does is it can make the burn get deeper. You get something called vasoconstriction, where your blood vessels constrict, and it holds the heat inside, and you can make your burn deeper. But also people apply things like toothpaste because they think it's minty fresh and cooling. And actually what it does is it applies a layer over the burnt skin, and it holds the heat inside. So actually inadvertently people are making their burns worse by doing the wrong first aid. So it's really important that we get that message out there, that the best thing for most burns is cool running water, for as long as you can, but at least for 20 minutes.
Interesting. What about aloe vera? Because that's always one I heard growing up. Is that a myth, or?
Not necessarily. Aloe vera gel has its place if you've got a burn where the skin is not missing. So if your skin is just red, a bit like a posh sunburn, but it's not actually blistered the skin, then aloe vera is very appropriate. But we would always say do that 20 minutes of cool running water first, because that's what reduces the risk. That's what stops the burning process going through more layers of the skin. And then if it's just pink and there's no blistering, aloe vera is fine. But if there are blisters, then it stings and it's not the right thing. Sorry,
that was a personal curiosity actually. So are there any other kind of considerations or common things that people miss when they're in the heat of the moment and they've had a burns injury, maybe to themselves or to a child?
Yeah. So if you were thinking about somebody who, for instance, has had a flame burn, if the clothing is still on fire, then the stop, drop and roll approach is the right thing to do. So stop, drop to the floor and roll around. That can be quite difficult for somebody to think of when there's flames, but somebody around them may be able to help them to do that, and then cover them over with, say, for instance, a fire blanket. To put the flames out, which is really, really important. The other thing, thinking of things like scalding injuries, is clothing. It's important to get that clothing off as quickly as possible, because clothing holds the heat, and so it can make the burn get deeper. And if you're thinking about children, for instance, don't forget that nappies can absorb hot water. So people might take off the top of the child but they forget to remove their nappy, or for instance things like socks and shoes get left on, and then that holds the heat for longer and it can make the burn worse.
Yeah, okay, very interesting, good to know. How important are fire safety devices in the home, such as an extinguisher or a fire blanket like you just mentioned?
Really important. I think a lot of people don't think that they need them because they don't think it's going to happen to them, but it can make a big difference as to how deep the burn is or how somebody recovers from a burn injury. The classic things, smoke alarms, most of us have them, but making sure that they're working is so important because it gives you those extra vital few seconds to get out of the house and stop yourself from having a nasty burn injury. As you say, the fire blankets, we all hope we're never going to have to use them, but if somebody was on fire, then they're the most appropriate and best thing to use to extinguish those flames. So really, really important, and they should be kind of the basics that we all have in our home. You know, we should really be prioritising those over things like mobile phones and televisions and all the things that we say we can't afford them, but actually we've got all these other gadgets that don't save our lives that we prioritise.
Interesting. Talking back to your experience, obviously, over the years, is there any particular stories that stand out for you?
I mean, I've looked after many children and adults over the time. One of the most, probably the injury that we're seeing more of around people charging their mobile phones in their bedrooms, particularly teenagers, because we know that for teenagers and adults, their phones are attached to them for most of the time, and even overnight they'll be charging their phone but they'll still be on it long into the night. And we had a teenager who was using their phone, it was being charged, and they fell asleep with their phone beside them. Often people actually tuck them under their pillows whilst they're asleep because they don't want to miss anything that's coming through for them. And he fell asleep with his phone tucked under his pillow. It got hot and it started to smoke. He had his dog on the bed with him. His dog jumped off the bed and ran to the door and was scratching on the door to get out because he was disturbed by the smoke. And that was what woke him up enough to realise that actually by that point his pillow and his duvet were catching fire. And he ended up with quite a nasty burn, which could have been a whole lot worse if it wasn't for the fact that he had his dog sleeping in the room with him. Because we don't have smoke alarms in our bedrooms generally, they'll be in the hallway, and by then for him it would have been too late. So so he owed his life to his dog, but also taught him a very valuable lesson, which a lot of people do, around charging your mobile phone overnight and keeping it in your bed with you.
And that was just the heat from the mobile phone getting hot?
The heat from the mobile phone getting hot and igniting the fibres in his pillow and his duvet.
Wow.
Yeah.
Wow, that's an amazing story. What message, if you were to share one message, what message would you like to share with families to help get that awareness out there, help prevent fire-related burns at home?
So I think, as you say, it's all about the awareness. It's about actually spending time to stop and think about, what have I got in my home that could be a risk and what am I doing about it? It's also recognising that sometimes things happen and they're avoidable, and knowing what to do in the event of a fire, but also knowing what to do in the event of getting a burn injury is so important, because it can make the difference between it being a minor burn and a major burn with months in hospital and all the things that we know go with that. So it's just about, I guess, increasing our awareness and knowing what to do. And recognising that accidents will still happen, and you know, we shouldn't give ourselves a hard time about that. But in our busy lives, sometimes we forget where our priorities are. Sure,
that's a good message. Why, for you, is it important that companies like Fire Chief get involved with charities like the Children's Burns Trust? Obviously, you're an ambassador, to help raise that awareness.
It's really important, you know, it's all about the collaboration. You know, we're working together to get that message out there, which is so important. One of the key priorities for the Children's Burns Trust is around prevention. You know, preventing these things from happening by having your smoke alarms and your fire blankets and all those things is really, really important. So when we work together and look at where the potential risks are, as a service we see the type of injuries that are coming in, and sometimes we see peaks in those, we see themes around things that are happening, then we can work together to target the right audience to prevent some of those accidents from happening. And the Children's Burns Trust is a fantastic charity which supports the families, and my role as ambassador to them I'm helping them with their prevention. I'm signposting
Sure.
parents and children, families to their service to support them with that. And if they can be supported in their role by services such as this, then it makes a huge difference.
And off the back of that, then, talking about awareness, how can campaigns like this Safer Homes campaign help to reduce the number of people that ultimately end up in a specialist burns unit?
Yeah, so by having the awareness, by getting that message out there that these are the type of injuries that can happen and the impact that they can have, then hopefully we can reduce the amount of people that are actually experiencing those, because things like house fires are so hugely traumatic for everybody involved, not just the people that are injured, but their surrounding family, their friends, the fire service, everybody that's involved. It's so traumatic. That if we can work some way to just reducing a few of those deaths or major injuries, then we're all doing a good job. Yeah,
that's very good. Thanks very much for coming and sharing with us some of your stories and advice. What if you're someone watching this video right now, what can people go and do? Where do they go to support all the work that the Children's Burns Trust is doing to support those that have had burns and the families?
So the Children's Burns Trust has a website, and there's lots of really helpful information on there, including lots of important messages about preventing burns, which would be really helpful for people to get on board with and share that message widely.
Sure.
Looking at things on social media, there's always opportunities for fundraising. It's the backbone for keeping the charity going is the fundraising side of things, and that money then goes to helping children and families who've had burn injuries. So fundraising, corporate sponsors, those kind of things is really, really important to help the charity continue its good work. So also once a year we have a really important day which is called the National Burns Awareness Day, and it's on the 15th of October this year. And we all get together as charities and burn centres to really take the message of prevention forward. We focus on different things each year. So for instance, we've seen a huge rise in things like hot water bottle injuries in both adults and children, particularly now that they're marketing cute little teddy bears with hot water bottles inside them for children. People haven't got a lot of money at the moment. They're trying to not put their heating on, so they're using hot water bottles to heat their homes, and we saw a huge rise. So we all got together and decided to have that as our focus 1 year for the National Burns Awareness Day. And so we choose a topic each year. It's a really important day, and it's really helpful to us if everybody gets behind that and shares the prevention messages.
If you want to find out more about the Safer Homes campaign and the important fire safety messages that we're spreading with charities like the Children's Burns Trust, head to any of your main social medias to find us there, or go to our website firechiefglobal.com and head to the Home and Leisure section to find out more information.